The mindful practice of sterile technique helps protect patients from surgical post-operative infections. Asepsis in the operating room is the conscientious responsibility of each surgical team member before, during, and after surgery. This videotape and accompanying study guide demonstrate the aseptic practices during scrubbing, gowning, and gloving for operating room personnel. This videotape shows the surgical hand scrub procedure, techniques for gowning and gloving, the steps for assisted gowning and gloving, a review of the gown and glove sterile areas, and the procedure for safely removing gown and gloves. The purpose of the surgical hand scrub is to remove soil, debris, natural skin oils, hand lotions, and transient microorganisms from hands and forearms. Decrease the microorganism count on the skin. Suppress growth of the microorganism population during surgery. And reduce the hazard of microbial contamination by skin flora in the surgical site. The surgical hand scrub uses a mechanical and chemical process to control the two types of organisms that inhabit the skin. The two types found on the human body are transient and resident organisms. People acquire transient organisms by direct contact. These organisms typically attach loosely to the skin surface. During the surgical hand scrub, the mechanical friction of the scrub brush removes almost all of the transient organisms. The antimicrobial or antiseptic agent used inhibits resident organism growth. Resident organisms are the flora below the skin surface in hair follicles and sebaceous and sweat glands. They are adherent and resistant to removal. During the surgical scrub, the chemical action of the antimicrobial or antiseptic agent reduces and neutralizes the resident skin flora. Before performing the surgical hand scrub, the scrub person should observe practice guidelines in relation to the operating room apparel. These guidelines are found in the study guide that accompanies this videotape. Either the anatomic timed scrub method or the counted stroke method are used during the scrub procedure. The two methods are defined later in the videotape. Before the surgical hand scrub, the gown package containing a sterile gown and towel should be opened. Then the scrub person opens the sterile scrub brush package and positions it for easy access. Adjust the water to a comfortable temperature and flow to prevent spraying of the scrub attire. Water on the non-sterile scrub attire may soak through and contaminate the sterile gown. Wets hands and forearms. Washes with an antimicrobial agent, lathering the hands and forearms to 2 inches above the elbow. This will loosen surface debris and remove gross contamination. Cleans under the fingernails with a metal or disposable plastic nail cleaner while holding the hand under running water. Discards the nail cleaner. Washes, soaps, and then rinses hands and arms thoroughly while keeping the hands and fingers pointed upward so that water drips off of the elbows and away from the scrub attire. Removes the scrub brush from the package and applies soap from the soap dispenser or squeezes it under the water to dispense the soap. Holds the brush in one hand and cleans the nails and subungual area of the free hand. Holding the brush perpendicular to the fingertips, scrubs using a back and forth motion on all 4 sides of each finger, including the web spaces. scrubs the palm and back of the hand to the wrist using a circular motion. Maintains a lather. Make sure that all skin surfaces are sufficiently exposed to the friction of scrubbing and the antimicrobial agent. Continues at the wrist, scrubbing to 2 inches above the elbow on all sides of the arm, while rotating the arm from back to front. Transfers the scrub brush to the other hand and repeats all the steps for scrubbing from the fingertips to 2 inches above the elbow. During the scrub, turn off the water when not needed. Discards the brush and rinses hands and arms under running water, starting at the fingertips and working toward the elbows, keeping hands upright and elbows in a downward position. With fingers and hands pointed upward and away from the scrub attire, the scrub person enters the operating room using their back to push open the door. The scrub person will use either the anatomic time scrub or the counted stroke scrub. As the names indicate, the anatomic timed scrub times the scrub of each area. The counted stroke scrub counts the strokes for each area. The scrub person should follow their facility's policy. The anatomic timed scrub is for 5 minutes. This provides a 2.5 minute scrub per extremity. The fingers and nails are scrubbed for 30 seconds. The palm and back of the hand for 1.5 minutes. And the wrist to 2 inches above the elbow for 30 seconds. Repeat these timed scrub steps for the other extremity. In the counted stroke scrub, the number of strokes are counted for each extremity. The nails for 30 strokes. All sides of each finger for 20 strokes. The back of the hand for 20 strokes. The palm for 20 strokes. And each third of an arm to 2 inches above the elbow for 20 strokes. Repeat the counted scrub strokes for the other extremity. If any part of the hands or arms inadvertently touches the sink, add 10 strokes to that area of skin to correct the contamination. The scrub person must thoroughly dry their hands and arms before donning the gown to prevent organisms on the wet skin from strike through and contaminating the scrub attire. The scrub person will pick up the sterilized towel without dripping water on the gown and move away from the table. Keep the towel away from the non-sterile scrub attire by bending forward slightly. Hold up one end of the towel and let it open full length. Use 1/2 of the towel for one hand and arm, drying the hand first. With a rotating motion of the arm, pat the skin up to 2 inches above the elbow. And with the dried hand, carefully reverse the ends of the towel and dry the other hand and arm with the unused half. Discard the towel. To don the gown, lift the folded gown directly upward from the sterile package. Step back from the table. Carefully locate the neckband and hold the inside front of the gown just below the neckband with both hands. Let the gown unfold while keeping the inside of the gown toward the body, without touching the sterile exterior of the gown with bare hands. And hold the hands at shoulder level, away from the body, and slip both arms into the armholes simultaneously. The hands remain inside the cuff. It is important that the circulating nurse know their role in the gowning procedures. The circulator may assist by reaching inside the gown and pulling the inside seam, and touching only the ties or snaps, secures the back of the gown at the neck and the waist. To don the gloves with the closed glove technique, the scrub person will use their right hand while keeping both hands within the cuffs. Grasp the folded cuff of the left glove. Hold the top edge of the cuff in the left hand above the palm. Place the palm of the glove against the palm of the left hand. The glove fingers point up the forearm. Grasp the back of the cuff in the right hand and turn it over the end of the left sleeve and hand. Hold the top of the left glove and underlying gown sleeve with the covered right hand. Pull the glove over the extended left fingers, pushing the hand through the glove until it completely covers the cuff of the gown. And then glove the right hand in the same manner by reversing hands. The open gloving technique is used during a surgical procedure when one or both gloves must be changed without assistance. This technique is also used when performing sterile procedures, such as bladder catheterization or insertion of an IV cut-down. To change gloves during the procedure using the open gloving technique, the scrub person should step away from the sterile field. The circulator removes the contaminated glove. The scrub person picks up the glove under the cuff with the uncontaminated glove hand. Inserts the hand into the glove and pulls it on, leaving the cuff turned well down over the hand. Avoid inward rolling of the cuff. The bare hand does not touch the outside of the glove. And rotates the arm and pulls the cuff of the glove up and over the sleeve cuff, letting the gloved fingers touch only the outside of the other glove. A scrub person may assist another member in drying, gowning, and gloving. The scrub person will open the towel that the other member will use to dry their hands. Lay the towel on the team member's hand without touching their hands. Hold the gown at the neckband and carefully unfold it. Keep the hands on the outside of the gown, forming a protective cuff of the neck and shoulder area, as the person being gowned holds both arms outstretched. Offer the inside of the gown to the other member so they can slip their arms into the sleeves. And release the gown when the team member's hands are in the sleeves. The circulating nurse reaches inside the gown and pulls the inside seams. The scrub person adjusts the sleeves so the cuffs fit properly. To glove another team member, the scrub person always gloves the other person's right hand first. The scrub person picks up the glove with their fingers under the averted cuff. They hold the palm of the glove toward the person being gloved. The scrub person stretches the cuff to open the glove while holding their thumbs out to keep them from touching the other team member's bare hands. As the other person inserts their hand into the glove, the scrub person exerts upward firm pressure, making sure the hand does not go below the waist. Then the scrub person unfolds the averted glove cuff over the cuff of the sleeve. Assists the gloving of the left hand by repeating the steps. And holds the tie as the other team member turns when a wraparound gown is used. The surgical team must observe precautions to avoid contamination and maintain the sterile field. The hands should be kept above the waist and in sight at all times. The sterile areas are the front of the gown from the table level or sterile field to 2 inches below the neck. The sleeves from 2 inches above the elbow to the cuff. And the surgical gloves. If any part of the sterile attire becomes contaminated, immediate corrective steps must be taken. For instance, if a glove becomes contaminated or perforated during surgery, it must be changed immediately. At the end of the procedure, the gown is always removed before the gloves. To prevent contamination of the wearer's scrub attire, the circulator unfastens the neck and back closures of the gown, and the wearer then grasps the shoulders of the gown, pulls the gown downward from the shoulder and off the arms, and turns the sleeves inside out, and discards the gown in the appropriate receptacle. As the gown comes off, it usually turns the cuffs of the gloves down. To remove the gloves, the wearer can use a glove-to-glove and then the skin-to-skin technique. This approach protects the hands from the contaminated glove. The wearer grasps under the cuff of the left glove with gloved fingers of the right hand and pulls it off inside out. They slip the ungloved fingers of the left hand inside the right glove and then slip it off inside out. They discard the gloves in the appropriate receptacle and wash their hands with soap and water. The aseptic principles for scrubbing, gowning, and gloving prevents contamination to the surgical wound and helps control infections. It is the individual responsibility of each surgical team member to conscientiously practice these principles for the safety of their patients.